3 million coronavirus cases across the U.S. And this morning, there are concerns that those daily cases could climb even higher thanks to people who are trying to become infected. More and more people are hosting what are called COVID mixers. Officials say these people are trying to help their children build immunity to coronavirus by contracting it on purpose. Diana Zoga shows us why doctors say this is a very bad idea.
Online, there are discussions about encouraging a COVID-infected child to play with healthy kids, to spread the disease and, in theory, build immunity. It's called a COVID or corona mixer. Dr. Jeffrey Kahn, chief of infectious diseases at Children's Health and UT Southwestern, calls it dangerous.
I can't emphasize this enough. Do not do this.
Dr. Kahn explains that while COVID-19 is relatively uncommon in kids, it's unclear if there are long-term consequences for those who are exposed. And with coronavirus, there's no proof you can try to contract a mild case to avoid a more serious illness later.
If your child gets infected, there's no guarantee that that child is now protected against future infection. So on just about every level, the logic behind these COVID mixers falls apart terribly.
The mixers harken back to chickenpox parties when parents intentionally exposed kids to the chickenpox. But unlike the chickenpox, there is no vaccine for COVID, and adults in the house are not immune.
There's a wide range of severe illness that could result from these and the impact on other family members, community members. This is not a good thing to do.
Dallas County Health and Human Services Director Dr. Philip Wong says the health department has not received official complaints about COVID mixers. But doctors warn knowingly spreading the virus can have a chain reaction with deadly consequences for everyone.
If you're considering this, please pause and think about the implications of doing this. You're going to put your child at risk. You're going to put people in your home, your household at risk. And of course, you're going to propagate the infection, or potentially propagate the infection in the community.
And doctors point out that while some children who get COVID-19 only have mild symptoms, others can suffer serious complications like that mysterious multi-system inflammatory syndrome in children. So we've told you that's a condition where different body parts become inflamed. The CDC defines this as someone under 21 years old with a clinically severe illness requiring hospitalization with at least 2 multi-systems involved. At least 4 children in Indiana have been treated for this.